detected by a mammogram. One of those had no family history whatsoever. One of those individuals also was coming from a healthcare system in the United Kingdom where she would not have characteristically had a mammogram in her early 40s and was able to identify a potentially curable form of breast cancer. Still, the other two patients that I saw were picked up because they felt something in their breast. So it's very difficult from my perspective as a breast cancer surgeon to tell women, oh, you don't need to worry about knowing what's normal for you, or you don't need to worry about having a mammogram in your 40s, because more people need to be screened to be able to save one woman's life. So from that sort of perspective, I don't agree with the task force recommendations, and I myself am encouraging my patients to continue with the practice as is. So starting annual mammography at age 40, I do suggest that they at least know kind of what is normal for themselves. There are certainly some individuals who find that doing a self-breast examination is very anxiety-provoking. There are some individuals that feel like their breasts are relatively lumpy, bumpy, and if they examine themselves, they become more anxious. In those individuals, do I harp on them that you need to be doing this on a monthly basis? No, I don't, personally. But at the same time, I do find value in making sure that at the very least, they are making sure that they're getting in to see their physicians, that they're making sure that they have their appropriate imaging completed as well. Now, I also feel a little bit strongly about that 75-year-old age limitation also. I personally have operated on women in their 90s, and they have done just fine after surgery. And if you ask them, would you have done things any differently? Would it have been better for you if you hadn't ever had that mammogram done? And their response is overwhelmingly, I wouldn't have done anything differently. I'm glad that it caught it. Certainly some women that are 75 behave like a 65-year-old woman or a 55-year-old woman even in some cases, and there are some 95-year-old women that truly do look their age. So I don't think that you can say definitively, this age is where we need to start, this age is where we need to stop. But it's, again, being aware of an individual's personal history as well as their own health situations that each person needs to be considered on an individual basis.